colleagues in Rwanda coined this term, which I like. She calls this compassionate observation. So we're observing people with a sense of sympathy and empathy and compassion. We're trying to get to the untold stories. We understand that each person has things of meaning in their life, right? They're not a disease, right? Their thing of meaning might be a child, it might be a partner, it might be their animals they need to take care of, right? It allows us to practice humility, because if we are always posing questions, then we are learning, right? I feel like my patients have taught me so much about farming, right? They've taught me a lot about the transportation systems in the country. They've taught me a lot about the practices and the customs of traditional medicine. And so it allows us to be learners, which enriches our practice. And then it allows us to identify the many different ways you can engage with patients. Across the world, so many of our traditional healers have become part of our network. They've become community health workers. They've become trusted individuals to give information. And so rather than eschewing anything but your Western biomedical model, what a biosocial analysis does is create a much, much more robust team and a way to engage with the patients. So I love that, compassionate observation. So just to continue here, the biomedical oriented doctor centered consultation is, you say your name and you introduce, you say the chief complaint, right? Tell me what is bothering you, right? And then you take the history of, we call history of the present illness. So present illness, nothing past, right? Nothing social, nothing holistic. So you coughing, when did you start coughing? Are you coughing blood, right? We never even got to that, because in a lot of ways those are less important, right? History of the present illness, the review of symptoms, right? So you're going into, if the person says, well, I'm sneezing, and you as a doctor know, okay, sneezing is unimportant to this disease, you're going to skip right over that. But that might be something important to them. And then we do the physical exam and the diagnostic tests and give the diagnosis, treatment, patient education, follow-up. Okay, so that's the biomedical oriented. It's gotten us a ways in the world, right? But that is very different than what we think the biosocial analysis should be. And I don't know why I'm not able to advance these slides now, but I will keep going if I can. No. All right. So one of our colleagues from Rwanda, in doing this work, Dr. Vincent Kubaka, he found in interviewing patients about satisfaction with the Rwandan medical system, he said the main thing was that the doctors should feel our pain. So people were not complaining about the quality of care. They were not complaining about their diagnosis, their medicines. They were complaining about the sense that I am being seen and felt, right? That sense of empathy. So even when we study this, these are things that are very, very important. Okay, so this is what the narrative medicine approach would look like in comparison to that biomedical approach. Your introduction is not just say, here I am, who are you, but an invitation to share the patient's story. Active listening. So not interrupting, which I think I did in Atlanta. I didn't mean to. Not interrupting. Exploring the patient's perspectives, right? These are very different. And then collaborative building of a story. We're reflecting, we're clarifying, okay, and then what did you think? We're being empathic, right? We're exploring the context in which the patient lives. And we know from all of the discussions we're having on social medicine that context is the main thing that causes a differential in outcomes, not a bacteria, but the context. And then we have a shared decision making. You will go and then we will look at this together, right? So this is the different approach of narrative medicine. So I hope that in this, you can practice it. Practice these kind of interactions as you see patients, practice in the community. You will learn so much. You will become a much, much more wise person, even more than a practitioner. You'll become a more wise person. And we have a few references here, but there are many others. So thank you so much.